cancer or a lump on your breast could mean breast cancer. But what about oral cancer? Terri Alani questioned a spot under her tongue for 7 years before finally finding out what it was. Doctors basically told her it's nothing. With help from family and cosmetic dentist Dr. Terri Alani, she probably saved her life. Please welcome them both to the show today. Good morning. Dr. Alani, this speaks to the importance of when you go to doctors for certain things, routine checkups and stuff, you're not only checking your specific area, but you can also detect other things that might be going wrong.
Exactly, and nowadays oral cancer is on the rise, so it's really important that anyone over 17 years old has an annual oral cancer exam, and that's due to the HPV virus and then a lot of other things,
Yeah.
yes.
All right, Terri, you had this spot on your tongue that just looked bizarre. And so, obviously, you asked about it, and what were you told? And here's a picture of it right here. We can see this little spot right underneath there. You asked about it. What were you told?
That I went to, I guess, 2 doctors. My regular dentist was watching it, and then an ENT. And it had started to change, and...
You just knew something wasn't right. And in fact, you're a registered nurse at a hospital. So, you know, you're always trained that when something new pops up, question it. And when it starts to change, you question it some more.
Right.
And so, Dr. Alani, again, perfect person to diagnose this is a dentist, but not all dentists are the same.
Well, exactly. And when she came in, I saw it, and I thought it was really suspicious. And I said, you need to go and get this checked out. And so what did you do? Did not.
I did not. I actually, with the best of intentions, I was going to, but, you know, I guess everybody's life gets busy.
Yeah, and you've been watching this for how many years?
Going on 7 now.
Yeah.
And it actually had just started to change within the last year and a half. And I kept asking and asking. And then when Dr. Alani, I think she was the only one who really just said, I don't like it.
Yeah.
Just go have it checked one more time. I was like, oh, okay. So I did. And... even the surgeon said nothing. Because, of course, my first question is it cancer?
Yeah.
Nobody wants to hear that. And so they looked at it, not cancer. But, oh, my goodness, you have some very large bony growths. Let's just go ahead and take the bony growths, which are called mandibular tori, out.
That's these things right in here.
It's now or it's later. And I thought, okay, I'll just do it all at once. And they said they could do a very clear, clean incision on the other spot. So we did it. First question out of surgery, does it look any different? Is it cancer? No. And then when my pathology came back,
it was oral cancer.
It was squamous cell carcinoma.
All right. April is Oral Cancer Month, by the way.
And I'd gotten a call from her, like, about right afterwards, and the office said she wanted to talk to me. I went, oh, God, what have I done? You know, the calls we get from our patients, you never know. And she thanked me. She said, you saved my life. And basically, my point is, if the dentist sees something, guys, we do know what we're talking about. Make sure you get it checked out.
Yeah, and insist. And you insisted because people kept saying it's nothing, it's nothing. It's got to be checked out by the right doctor. Approximately 50,000 people in the U.S. will be newly diagnosed with cancer this year. And the causes of oral cancer, several things, alcohol and tobacco use.
Alcohol and tobacco use. If you are really the face of cancer used to be an older gentleman, alcohol and tobacco, 15 times increase in oral cancer. Now, of course, the HPV virus has appeared, and it can be anyone that's 17 years old and up. One person dies every hour from oral cancer. When found early, Deborah, 80 to 90% survival rate, but there's a 50% mortality rate if it goes to the late stages. And once it's in those late stages, 40% will die within 5 years.
Yeah.
Those are really staggering statistics.
And oftentimes when we hear things like, you know, tobacco or alcohol, oh, I don't do that, so I don't have to worry about it. It doesn't mean you don't have to worry about it. It just means your chances may be increased, but it can happen to anyone.
Exactly. We have these medical devices. They're quick. They're easy. They're painless. They take 3 minutes to do. We don't just detect with the naked eye anymore. It's done with an exam. And basically, I'm going to turn this light on. And it's a light, a special light that highlights the suspect areas. And this is called the Velscope, and this is called the Identify. Either one will work.
Yeah. This also makes us realize, too, that a lot of times we'll come into the dentist's office when something's hurting. We should be in, at least every 6 months for cleaning and so that you can check up and see what's happening.
Exactly. And, you know, if the dentist, most dentists will charge a minimal fee. It's very inexpensive to do an exam. It's just like a prostate exam, a mammogram. You want it to be negative. So take the extra step and have the exam done. It can be done by the dentist or the hygienist. Yeah. We're highly trained.
And as we know, the earlier you detect, the better chance you have of survival.
Exactly.
How are you right now? What's your situation? What was your treatment?
They got it the first time.
You were stage 1,
I was
correct?
stage 1,
Yeah.
no metastasis, no lymph node involvement. So that was a good thing.
Congratulations on catching that and teaching us the lesson that we have to be persistent, especially when someone else says, yeah, better look at that. We have to be persistent. Dr. Alani has a special offer for Great Day viewers. If you come in for a new patient exam, you will receive a free oral cancer exam as well. If you'd like more on Dr. Alani's services, you can call 713-621-5141, 713-621-5141, or visit her online at Texastoothlady.com or on Facebook. Plus, you can catch Dr. Alani and her brother, Dr. Wayne Alani, on 950 KPRC every Sunday at 11 a.m. The show is called The Alani Docs, but they cover a little bit of everything. Thank you.